our next presentation. We have Gaurav Agrawal, who's the business value manager from Benchling, an organization that provides cloud informatics for life science R&D. And Gaurav will be speaking to us today on measuring the value of a digital transformation. Welcome, Gaurav.
Wonderful, thank you. And hi, everyone. Thanks for joining this talk. And I realize that we're a little bit short on time, so I also have quite a bit to get through, but I'll do my best to fly through it. So my name is Gaurav Agrawal. I'm part of the business value team at Benchling, and we're going to be talking a little bit about how companies can measure the value of their digital transformations. So my primary goals of the presentation are to do a little bit of framing of the importance of digital transformations and identify some of the challenges that biopharma have faced to date around the adoption of digital technologies for R&D. We're also going to present a framework to develop a business value case specific to your organization and use cases. And lastly, we'll also discuss Benchling's experience in guiding biopharma companies through the business value journey. So let's get started. I think we've heard a few talks today already. It's very clear that digitalization is very important, right? Data collection, data management in pharma has become more challenging, and data is being used in new ways like machine learning and artificial intelligence. And of course, the data infrastructure overall has struggled to keep up with the rapid pace of R&D. And for the most part, there was a great study done by Accenture a few years ago of about 250 pharmaceutical executives, and biopharma acknowledges the importance of digital for R&D, right? In this study, about 72% of biopharma leaders agreed that digital is critical in achieving R&D imperatives, but only about 36% of biopharma companies are actively adopting digital today, with the other 64% seeing it as somewhat of a risky proposition and either in early stage exploration or waiting and watching their competitors to see how they benefit first. And on that note, for those early adopters, over 60% of them have struggled to actually measure success and impact from the transformation thus far. And measuring the actual business impact is very critical, right? It can help justify the change management and the investment required for these technologies. It can further encourage and support adoption, and so on and so forth. So that's why we're going to talk about that today. And I think we all can generally agree that digital R&D solutions can do amazing things. These solutions can help increase scientist productivity, improve collaboration across teams. It can accelerate R&D insights and enforce data integrity, and even reduce R&D costs if we make teams more productive and consolidate IT systems. And aggregating this value over the long term can help biopharma do a couple of really big things around improving decision making, right? We've all heard the phrase fail early and fail often, but really this is about getting better data insights to identify the right drug to advance to the clinic and improve your probability of success. And also hopefully help shorten development timelines, right? Hopefully this will help reach a greater number of patients more quickly, help maximize exclusivity, and of course, maximize revenue as well. So digitalization of your R&D practices can have a transformative potential, especially if it's applied in a rational way. But that's the tricky part. So what we're going to talk about now is how to develop a digital strategy that provides value where you need it, and how to measure the impact of that transformation. So we see building a business value case as kind of a three-step process. The first is to assess your current level of digital maturity. The next is to define relevant value metrics specific to your scientific flows and use cases. And finally, develop a business value case by measuring the actual business value that you're getting from that solution. So we're going to go into detail on each of these. So let's start with assessing your digital maturity. And what this is all about is really critically evaluating your current systems and processes across your scientific use cases, and understanding your current state of R&D as well as optimal state of R&D where you want to be. So when we look at systems, we can ask questions such as, are you tracking samples and data in paper notebooks or maybe across multiple spreadsheets by hand? Are you relying on a custom-built in-house solution that maybe lacks some flexibility? Maybe you've already employed some kind of a digital solution or an ELN, but it may not integrate across different types of disparate systems, forcing users to juggle between software to find the data that they actually need. We can also ask questions around your current data capture and sample tracking processes, right? You can ask questions like, are the end users primarily capturing results by hand? Are they manually linking entities together, or does the system do this automatically? Are you leveraging laboratory instrumentation to automate workflows and gain efficiencies of scale? Or do your systems already help you proactively forecast and plan experiments, right? Maybe intelligently perform certain activities for the users or notifications with users. So by looking at this critically for your specific scientific use cases, and you can look at this across different dimensions, right? How are your systems and processes impacting your productivity, your collaboration, your process management, and other dimensions as well. You can establish both the current state baseline understanding of digital maturity, and you can also define your current limitations. And in the process, you'll get a much better understanding of where you need your R&D organization to be in order to optimize research programs. So at Benchling, we actually have a data maturity curve that we leverage. And here's an example of how we might look at one dimension, for example, R&D insights. So you can imagine a situation where you're capturing sample data and upstream and downstream sample lineage, capturing protocols and associated results from experimentation, and maybe inventory levels and locations manually in a physical lab notebook. And then you're transcribing those results over to an Excel spreadsheet and sharing that with a colleague. Here we would classify maturity as fairly low for this dimension. It's clearly a very manual, disconnected process that's prone to error, and it would be difficult to accurately track and share your data. But if, on the other hand, if all your data was being logged in a centralized platform that updates in real time and it enables on-platform data sharing, you're going to be fairly confident in your data quality, and you'll be able to optimize your workflow efficiency. That's bringing you to a slightly higher level of maturity across this dimension. So the point here is not to say you need to get from a 0 to 4 overnight. Every incremental improvement is a significant benefit and provides impact to your organization. And most importantly, when going through this exercise, just be honest about your level of maturity. You'll find some areas where you're very mature and some areas where you're lacking. And for those situations where you're at the lower end, it's best to just acknowledge it, understand why, and create a plan to move up the curve and get to the next level of R&D performance. So that's kind of step one. Step two in the process is to define your value metrics. And in this step, what we would do is leverage the findings from the digital maturity assessment to more tactically, clearly outline the specific limitations that you're facing from a data and process perspective, and then turn those into quantifiable or measurable value metrics. So for example, and I won't go through all these, but let's say one of the issues that you're facing is non-standardized data capture. Maybe that's impeding productivity and it's not making it possible for you to run machine learning models because of incomplete data sets or incompatible data sets. And one question you can ask is how much time is being spent on data capture, data search, and data cleaning by each of your scientists. If your data quality is poor and it's causing users to spend a ton of time on just updating and cleaning up data, you can ask, how confident are we with our data quality? And if you're maybe sending requests using emails, and that's resulting in delays due to some kind of a incomplete data sharing issue, you can ask, what's our current turnaround time for this assay request, whatever that is. So these are just representative types of questions you can ask, but really the point here is to critically analyze your limitations and turn those into quantifiable or measurable value metrics. And that leads into our last step in the process, which is to quantify the expected or actual value of the digital solution, right? So you can gather answers to these value metrics that you've outlined. You can gather this data through internal surveys or discussions with your scientists or other end users. And then you can also look at the impact once you've implemented the solution. You can also extrapolate the future impact if you're working with a digital vendor that tracks value across customers and can help you benchmark your expected future state. So, in this situation, if we go back to our example from the last slide, how much time is spent on data capture and data search? Maybe originally with your current systems or your prior systems, you're spending, each scientist spending 9 hours a week just on data search and data capture. And with a new solution, if you can get that down to 3 hours a week, that's a very significant productivity benefit, right? If the turnaround time for an assay request goes from 3 weeks to 1 week, that's a lot more time that can be spent on other tasks. That is one way to help shorten timelines and get better insights so that you can iterate on that. if your confidence in data quality amongst your scientists has gone from a 3 out of 10 to a 9 out of 10, I mean, this is subjective, but at the end of the day, if the end users in aggregate believe it's so low, then probably the data quality is that poor, right? So you can see that you can actually measure the value here of these specific value metrics that you outlined based on your limitations, and you can then leverage this output to prepare, a summarized report on the delta, on the change in value and how much efficiency gains have been seen. You can even use this to calculate an expected return on investment based on your investment in the digital solution. And most importantly, you can continue to track these metrics and update them over time as the digital solution is progressively adopted by additional teams across the organization. I'd also note that the impact stated on the right side is really a culmination of value across multiple dimensions. Right? You can imagine, if we're talking about productivity benefit, that's going to be something that is time saved for an individual scientist, right, on the order of hours in a day or across days. And if you move that up a level to collaboration across teams, if you're able to streamline workflows, you might impact an assay timeline, and on that note, a project timeline on the order of weeks. And if you're able to improve data integrity and accelerate insights, you might make better scientific and operational decisions and be able to hit your quarterly objectives for that quarter. And really, the culmination of benefit across all these different dimensions can help reduce costs, can help shorten timelines, and ultimately, we hope that you can identify the right drug to go into the clinic when you look back on this over many years. So you can see when going through this process, it's important to not to over-index on a single dimension of value like productivity, because value aggregated across multiple dimensions ultimately delivers the greatest impact to the organization. So I only have a minute or two left, but we've gone through this process with many of our customers, and I'll talk through one example of this that we have done in our experience. And this is a business value case that we did at Benchling. And I would note that this is just a highlight of a much deeper report that we prepared for the company, where we surveyed 20 plus scientists and conducted some interviews as well. But this company is a large biotech, and they develop a variety of different types of biologic therapeutics. And they have many teams involved in their workflow. And by going through the maturity assessment, what we uncovered was several challenges that they face. They had data silos that were hampering productivity and collaboration. Finding data was a huge pain point for them. Manual processes were being used for collaboration, including emails for request submissions and handoffs, which was just hampering workflow efficiency. Data quality was a big concern, and they were committing errors kind of left and right due to manual data transcription. And also, their existing systems didn't allow them to learn from past studies and make informed decisions for future studies. So study planning and forecasting was non-existent. So they licensed our entire platform, and the outcome was we went back to them about 6 to 8 months after they had implemented and adopted the system, and were able to demonstrate the value that Benchling provided them. So you can see on the top right the different metrics that we quantified. We found a 63% reduction in the time spent on data capture, data search, and data collection. We were able to see a 75% improvement in the ability to track sample and experimental data, and over 2x, double the improvement essentially in the ease of transitioning sample data across workflows to different teams. So it's a collaboration implication, and also the ability to forecast and review and approve and track studies. So there was obviously significant value that they got out of the platform, and we've continued working with this biotech as they have progressively kind of broadened their scope of usage of Benchling's platform with additional applications, and we'll continue to monitor value as we want to make sure that we're supporting companies in achieving their R&D goals. So that brings me to the end of my presentation. I just want to say thank you to Pistoia for hosting us today and for your partnership over the years. Recently, Benchling became a Helm adopter, and we're excited to be rolling out Helm notation support in our software within the next month. We're excited to join into the community of scientists who are creating standards to increase interoperability across the industry. And with that being said, for all the viewers, thanks for your time listening to the session, and feel free to reach out to me directly at the email address on the screen, and I'm happy to take any questions if we have a minute or two left.
Okay. So, Gaurav, what I want to suggest in the interest of time, that if people have any questions, that they contact you and your team directly, and you can see Gaurav's contact details on the screen there. Gaurav, thank you very much for keeping to time and for your excellent presentation.
Thank you.